MRI is a non-invasive radiological method of evaluating inner organs within the body. Essentially, from a patient's point of view, they come into the department, they don't have to have any special preparation. We would ask that they wear a gown during the study, and we place them in a magnet. Then, when they're in the magnet, we send in a sound wave, and depending on how the sound wave reacts with the person's body, a computer generates an image. I'll now demonstrate on a study that we've already performed how useful MRI can be in assessing the prostate gland. If you look in this region here, this is the prostate gland, and you can see that the resolution is very fine. Typically, prostate cancer shows up as areas of low signal intensity, which we can see in this region here. And the patient had a biopsy which showed that this area was in fact cancer in this region. What the spectroscopy and MRI examination allows us to do is to see if this area is confined to the prostate gland. So you can see this area here, this line is the prostate capsule, and you can appreciate that that is intact. So that this area of biopsy proven cancer is in fact confined to the prostate gland. It's important to assess prior to surgery because there could be involvement of very important adjacent structures. One area where we often want to assess is at the edge of the prostate gland. This is beside these two dots, which are the neurovascular bundle. These are the two nerves that are very important for erectile function. This area here, it has an inherent weakness where if there's prostate cancer in this region, it can break through the capsule and involve these nerves. And that's why MRI examination before surgery is very important. It changes how patients could be counseled. Patients and the surgeons are aware then if there's increased risk with regard to nerve damage. I'm just now showing where MRI can be very helpful in the assessment of the prostate gland. This gentleman unfortunately had quite extensive prostate cancer. The normal prostate gland should have a bright T2 signal intensity, as we can see in this region here. However, the remainder of the prostate gland with this gentleman was unfortunately abnormal, and you can see that there's low signal intensity in these regions, and these were consistent with biopsy-proven prostate cancer. What we look for when we look at the prostate gland is to see if the capsule is intact. That is cancer confined to the prostate gland itself? Now, if we start peripherally in this region here, see this black line here? This is the capsule, and you can see that it's intact, that the gray area extends up to it, but does not extend outside it. This is the adjacent neurovascular bundle, and this looks intact, it's not involved. However, as we go towards the midline, towards the patient's midline, the capsule is in this region here, still intact, but you can see in this area here, there's breach of the capsule. You can see there's a focus where the cancer is extended outside the capsule. And you can see from that case that I've shown you how useful MRI can be with regard to counseling patients and also with regard to their management. MRI can change both of these and can improve therefore patient outcome. Unfortunately, MRI is not suitable for all patients. Specific contraindications would be patients who have pacemakers, patients who have cochlear implants, and certain types of aneurysmal clips to intracranial circulation. Usually before all studies, patients are counselled and they fill out a questionnaire to see if there's any of these contraindications. Often patients at the time of the examination have some queries and some worries. Typically these are answered by the radiographer at the time of the examination, but I often meet the patients beforehand and we discuss the study.